4 years ago, I felt awful because of my psoriasis.
The flu?
Mild to moderate eczema.
Postmenopausal osteoporosis.
Moderate to severe plaque psoriasis.
Moderate to severe plaque psoriasis.
Or moderate to severe plaque psoriasis. Moderate to severe psoriasis or psoriatic arthritis.
Arthritis pain and inflammation.
Type 2 diabetes.
Advanced prostate cancer.
Moderate to severe RA for whom methotrexate did not work well enough. The CDK4 and 6 inhibitor for postmenopausal women with HR-positive, HER2-negative MBC.
For adults with advanced non-small cell lung cancer, previously treated with platinum-based chemotherapy, including those with an abnormal ALK or EGFR gene who've tried an FDA-approved targeted therapy.
Toenail fungus? What?
Use Jublia as instructed by your doctor.
Jublia is working it.
Most common side effects include ingrown toenail, application site redness, itching, swelling, burning or stinging, blisters, and pain.
Oh!
An erection lasting more than 4 hours, a sudden decrease or loss in vision or hearing.
Mild to moderate nausea and vomiting.
Unusual mood changes, behaviors, suicidal thoughts, increased risk of death or stroke. Fever, stiff muscles, and confusion. These may be life-threatening. Uncontrollable muscle movements. These may be permanent.
It may lower your ability to fight infections and may increase your risk of infections.
It may cause severe diarrhea, nausea, or vomiting, increased risk of depression, upper respiratory tract infection, and headache. Lower your ability to fight infections like TB, risk of death, serious, sometimes fatal infections, cancers, including lymphoma, and blood clots, tears in the stomach or intestines, serious allergic reactions, and changes in lab results.
Ruptured spleen, sometimes fatal, as well as serious lung problems, allergic reactions, kidney injuries, and capillary leak syndrome, abdominal or shoulder tip pain, trouble breathing or allergic reactions, serious, sometimes fatal crises, bone and muscle ache.
And it's steroid-free.
Risk of seizures, confusion, or abnormal behavior.
An allergic reaction, a lump or swelling in your neck, or severe stomach pain, pancreatitis, low blood sugar risk, nausea, diarrhea, vomiting, belly pain, and decreased appetite, dehydration, kidney problems.
Serious reactions including stroke, chills, fever, fatigue, weakness, breathing difficulties like shortness of breath, decreased oxygen and wheezing, dizziness, headache, high blood pressure, muscle ache, nausea, and vomiting.
Diarrhea is common, dehydration or infection, low white blood cell counts, serious infection that can lead to death. Serious liver problems, tiredness, loss of appetite, stomach pain, and bleeding or bruising more easily than normal. Blood clots that can lead to death, pain or swelling in your arms or legs, shortness of breath, chest pain, or rapid breathing or heart rate, with nausea, infections, low red and white blood cells and platelets, decreased appetite, headache, abdominal pain, tiredness, vomiting, and hair thinning or loss.
The risk of infections and cancer. Some serious infections require hospitalization.
Risk of death or stroke. High fever, stiff muscles and confusion, a possible life-threatening condition. Uncontrollable muscle movements. These could become permanent. High blood sugar can lead to coma or death. Increased cholesterol, weight gain, decreases in white blood cells, dizziness on standing, seizures, trouble swallowing, and impaired judgment or motor skills.
Worsening of symptoms, serious allergic reactions.
Serious, sometimes fatal infections and cancers, including lymphoma, blood, liver, and nervous system problems, serious allergic reactions, and new or worsening heart failure.
I'm Phil Mickelson. That's me, long before I had psoriatic arthritis.
May lower your ability to fight infections, serious, sometimes fatal events, including infections, tuberculosis, lymphoma, other cancers, nervous system and blood disorders, allergic reactions, persistent fever, bruising, bleeding, or paleness.
Serious allergic reactions, low blood pressure, trouble breathing, throat tightness, face, lip, or tongue swelling, rash, itching, or hives, severe jawbone problems, new or unusual pain in your hip, groin, or thigh, unusual thigh bone fractures, spine and other bone fractures, low blood calcium, serious infections, which could need hospitalization, skin problems, and severe bone, joint, or muscle pain.
Serious and in rare cases fatal bleeding, abnormal bleeding, tingling, numbness, or muscle weakness. You may bruise more easily, and it may take longer than usual for bleeding to stop.
It's not a narcotic. Increase the chance of heart attack or stroke, which can lead to death. Chance of serious skin or allergic reactions or stomach and intestine problems such as bleeding and ulcers, which can occur without warning and may cause death. Stomach bleeding and ulcers, swelling of the face or throat, or trouble breathing.
Serious allergic reactions, suicidal thoughts or actions, new or worse depression, unusual changes in mood or behavior, swelling, trouble breathing, rash, hives, blisters, muscle pain with fever, tired feeling, or blurry vision, dizziness, sleepiness, weight gain, swelling of hands, legs, and feet.
Headaches, seizures, confusion, and vision problems. For rare, potentially fatal brain conditions. Serious allergic reactions
can cause your immune system to attack normal organs and tissues in your body and affect how they work. May become serious and lead to death. Cough, chest pain, shortness of breath, diarrhea, severe stomach pain or tenderness, severe nausea or vomiting, extreme fatigue, constipation, excessive thirst or urine, swollen ankles, loss of appetite, rash, itching, headache, confusion, hallucinations, muscle or joint pain, or flushing. These are not all the possible side effects.
These are not all the serious side effects.
Ask your doctor if your heart is healthy enough for sex.
Don't drive or use machinery until you know how Lyrica affects you. Those who've had a drug or alcohol problem may be more likely to misuse Lyrica.
Don't use if you're allergic to Taltz. Before starting, you should be checked for tuberculosis.
Don't stop Eliquis unless your doctor tells you to.
Tell your doctor if you've been to areas where certain fungal infections are common, and if you've had TB, hepatitis B, are prone to infections, or have flu-like symptoms or sores.
And call your doctor right away. Tell your doctor if you're pregnant, nursing, have serious health conditions, or take other medicines. If you develop an allergic reaction, a severe rash, or signs of unusual behavior, stop and call your doctor immediately.
Tell your doctor about all your medical conditions, including immune system problems, or if you've had an organ transplant or lung, breathing, or liver problems.
Tell your doctor if you plan to or have recently received a vaccine.
No requirement for routine lab monitoring. Don't use if you're allergic to Otezla.
Tell your doctor if you've been someplace where fungal infections are common, you're prone to infections, have cuts or sores, have had hepatitis B, have been treated for heart failure.
Do not take Prolia if you have low blood calcium, are pregnant, are allergic to it, or take Exgeva.
Medical problems, including heart problems, lung problems, or history of stroke.
Don't take Trulicity if you're allergic to it, you or your family have medullary thyroid cancer, or have multiple endocrine neoplasia syndrome type 2.
Don't use if you're allergic to Cosentix.
Tell your doctor if you have a history of depression or suicidal thoughts, or if these feelings develop.
Seek immediate medical care for sudden signs of bleeding, like unusual bruising. Eliquis may increase your bleeding risk if you take certain medicines.
Don't take Celebrex if you have bleeding in the stomach or intestine, or had an asthma attack, hives, other allergies to aspirin, NSAIDs, or sulfonamides. Visit Celebrex.com.
Visit Emerald.com.
Be the you who talks to your dermatologist.
Ask your doctor.
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 Be relentless. Ask your doctor.
Ask your doctor. Ask your doctor.
Talk to your doctor.
Ask your doctor.
Ask your dermatologist.
Ask your doctor.
Talk with your doctor to see if adding Abilify is right for you.
Abilify is linked to uncontrollable gambling urges.
If you or someone you love was prescribed the prescription drug Abilify, listen closely. Compulsive gambling has been reported in users of Abilify. You may be eligible for money damages. Call us now to see if you qualify for an Abilify compulsive gambling claim.